left-hand corner, at least on my screen. Today's VA section webinar is co-sponsored by APA's Division 19, Society for Military Psychology, and APA Division 38, Society for Health Psychology. We're in for a treat today. The topic, as you can see on your screen, is diversity dialogues in supervision. And we hope for some interaction. We would like you to post your questions in the Q&A box that you can see at the bottom of toolbar on your screen. The Q&A box is a little different than the chat. So our presenters will be specifically looking in the Q&A chat box if you have questions, and work to address them during the webinar. If not, then we'll have to get back to you back channel. So, and I will be monitoring the chat box as well. In addition to Division 18 members, Division 19 and 35 members are eligible for free continuing education credit for this webinar. If you're not a member of 18, 19, or 38, we are asking for a paltry $15 fee, and I will share that information with you in the chat box toward the end of today's webinar. So without further ado, I would like to introduce our fabulous panel today. I will start with Dr. Jamylah Jackson. She is Director of Psychology Training at the VA North Texas System. Dr. Jackson's also the co-chair of the VA Psychology Training Council, a multicultural diversity committee. We also have with us today Rachel Ward, who's currently a doctoral candidate at Palo Alto University. Her primary research interests include exploring risk factors for trauma-related mental health outcomes and utilization of risk and resilience factors. We also have with us today 4 panelists who are going to participate. Dr. Jessica Fulton is the Psychology Internship Training Coordinator at the Durham VA Medical Center and co-chair of the Anti-Racism and Black Equity Advisory Board at the Durham VA Healthcare System. Dr. Tiffany Salcedo Rossitch is a Trauma Recovery Postdoctoral Fellow, also at the Durham VA Medical Center, where she completed her predoctoral internship. And she recently received her PhD in clinical psychology from UNC Chapel Hill. Dr. Joseph Fineman is a clinical psychologist at the Miami VA's Behavioral Health Interdisciplinary Program Team. Dr. Fineman is also a member of the VA Psychology Training Council's Multicultural and Diversity Committee. Tiffany Parisi is currently a doctoral student at Fielding Graduate University. Her primary research interests include exploring intergenerational transmission of trauma, resilience, and serious mental illness. And to give credit to thought contributors, I'm just going to mention very briefly, Dr. Viviana Padilla Martinez is a psychology program manager at the Lee County Healthcare Center, a part of Bay Pines VA Healthcare System. She is also a member of the National Multicultural Diversity Committee of the VA Psychology Training Council. And Dr. Linda Khatib is a postdoctoral fellow at the War-Related Illness and Injury Studies Center at the New Jersey VA Healthcare System. She's a trainee member of the National Multicultural Diversity Committee, also the VA Psychology Training Council. And last but not least, Dr. Angelique Chasen is a psychologist in PCMHI at the Michael DeBacke Medical Center, which is actually, I call it the Houston VA, and she co-chairs the National Multicultural Diversity Committee of the VA Psychology Training Council. And there you see them all on the screen. And with that, I'm going to mute myself and turn it over to Dr. Jackson and Ms. Ward. Take it away.
Thank you so much, Dr. Irwamasa. So we are really excited to talk with you all today about this topic of how to have diversity discussions in supervision. This topic came as an outgrowth of trainees asking about how do I bring up diversity issues in supervision if my supervisor doesn't, or if my supervisor maybe doesn't seem as aware as one might hope about some of these issues? How can I as a trainee be really effective and inappropriately bringing up some of those issues? And so that is a valid and really important question to answer. But as a training director, I really kind of thought about this from the flip side as well, because as important as it is for us to instill assertiveness and an ability to broach different topics into our trainees, it's as important to encourage our supervisors to create an environment that makes that feel possible. And to really look at the power differential that's inherent to the clinical supervisory relationship, and get information about how supervisors can create an environment that expresses openness, willingness, awareness of these different areas, as well as how trainees can broach some of these topics when it's needed in clinical supervision. So our goals for today are to talk about some concrete strategies that supervisors are using based on literature and the evidence base that's currently out there around initiating some of these topics, negotiating conversations around diversity in supervision. We really want to highlight behavioral approaches that are going to help supervisors and trainees be more effective in these conversations, and also to highlight those behaviors that might stymie effectiveness around some of these issues. And we want to talk about the different power dynamics that exist within training contexts, whether you're talking about between supervisors and supervisees, or training program leadership, and all those kinds of areas where those differentials can come up and can make it more challenging to address some of these topics that can be perceived as pretty provocative. So the way we have the panel discussion set up is that we have some supervisors and we have some trainees that are going to address a set of questions over the course of the hour. And then we will summarize those things and provide the resources where we're getting some of this information, and where you can read up and learn more about this areas and how you apply it. So without further ado, we want to set the stage for the first questions. How do we set the stage for diversity dialogues? So we'll start with Dr. Fineman here. As a supervisor, how do you encourage discussions around identities and supervision, thinking about the client supervisor? You are on mute, Dr. Fineman. Reveal your truth.
On technology. Thank you so much for, first of all, for having me as a panelist to discuss this, and for everybody on the call. Thank you for joining and really focusing on the importance of this within the supervisory relationship. Other than that, acknowledgement being something that I would pretty much do standard, it's another way that you intentionally demonstrate the importance of having diverse identities within supervision, just bringing it up intentionally. And really the intentional process of bringing this up within supervision happens way before, or should be happening way before you meet with your trainee for the first time. By the time you meet with your trainee, hopefully your site has developed in the brochure, in the handbook, a diversity statement saying that your site truly values diversity and is taking an intentional approach to training and to learning that incorporates context-driven diversity, equity, and inclusion in care. So I would say the first thing would be having things set within your program structurally. So once a trainee is able to review the material and see what your site has to offer, they already have an idea or perspective that if they're going to come to this site, this is going to be what's incorporated within the training. Now, what that means, though, is a very big commitment from the top down that this will be something that will be of emphasis within their training year. So we also need to be able to deliver on what we're stating. Now, having said that, once a trainee meets with me, and in my own material in regards to the rotations that I supervise or in psychotherapy work that I do, I also make it known clearly that that diversity, equity, inclusion is going to be incorporated in our work. I've already discussed within my materials about power, privilege, biases, and how we bring our own sensibilities into the work that we do. So again, just at multiple layers, letting someone know that this is going to be part of their process in itself creates a sense of safety, because it allows trainees to know that this is not something they're going to have to ask for, or they might get, that this is going to be integrated into their experience. And then once I meet with the trainee, I pretty much continue to expand on that and talk about how in our supervision, part of this process is, and as you'll notice in my approach, is I'm very relational, but I'm also trying to find out not only what interventions you're using, but how are they matching the sensibilities and worldviews of the patients that you're working with. And what about you? What do you bring in the room when you're meeting with someone? So making it an intentional focus from the start is the way that at least in the work that I do, it helps create that safe space. And if you look at what's available out in the research, it talks about finding different ways to reduce power structures, to be able to elicit these conversations and to be able to respond instead of in a proactive way, as opposed to a reactive way, because a reactive way could be you may be being complicit with a system that doesn't allow for all voices to be shared equally. So those are some of the ways that comes up. And then the other thing that happens within my work is I try to be as transparent, or if we're coming from a relational cultural view, as appropriately empathetic and transparent in the work that I'm doing. And that likely means me talking about the times that my biases are kicking in. You know what, I might be viewing this from this way, but I might be just coming from my sensibilities, or I might be mansplaining. Right now, I feel like I'm talking too much. So I'm probably mansplaining a little bit here. So if you're modeling that within your supervisory approach, there's a good chance, at least the feedback that I've received both in running 2 different diversity training programs and in supervision, that if the staff models that creates a safe place for trainees.
Thanks. Yeah, that makes a lot of sense. In particular, for most people, when they're starting a supervisory relationship, they'll say, this is the type of supervisor I am, this is the type of supervision I tend to provide. So being mindful and intentional about making sure that diversity is a part of that spiel, also in a part of how you orient the person to how you're thinking about your work with them over the next 3 months, 4 months, 6 months, whatever it's going to be, in addition to setting the tone for, we can actually talk about these things by bringing it up yourself. Absolutely. All right, Dr. Rossitch, as a trainee, how might you introduce discussions of multiple identities when your supervisor doesn't initiate it?
Hi, everyone. Happy to be here. So one of the ways that I've found most helpful, especially when my supervisor doesn't initiate these conversations, is at the beginning of our supervision time together. So when you're having conversations about training goals, one of the ways I've brought this up is mentioning that having these conversations is one of my training goals. So in particular, like specifically discussing how cultural identity, not just my clients, but mine and the interaction with my supervisors may influence or shape the dynamic in our work together. So when I've found that, like when I frame it as a training goal in the beginning, I then feel comfortable bringing up topics that come up in my work with my clients, and my supervisors have been very receptive to it. Also, a great way to bring this in is when having discussions at the beginning about approaches to case conceptualization. One of the ways I've talked about this is mentioning how, for me, cultural factors are something that I see as part of the case conceptualization and infusing it throughout. And so kind of having that conversation early on and being open about my approach has been helpful, so that I notice I feel more comfortable bringing up these topics as they occur in supervision. And fortunately, I haven't had any negative experiences at doing that way. And then I've also found myself feeling more comfortable than talking about maybe issues or biases that come up in terms of maybe the cultural lens that I'm seeing things through with my supervisors. So I've found that approach very helpful, is having that conversation at the beginning.
Yeah, I think you gave some really great examples about how, as a trainee, you are also introducing yourself to the supervisory relationship and the supervisory context at the beginning of your work with someone. So having that opportunity to say, this is something I'm really looking for, this is something that's really important to me to beef up in terms of the skill set and all these other kinds of things can be incredibly important. All right, so now we are setting the tone.
All right.
And so this is going to be a question for Dr. Fulton. How do you create an environment that speaks to willingness to get critical feedback from trainees? With respect to cultural issues, do the same approaches apply?
Hey everybody, it's Jessica. My pronouns are she, her, hers. And in thinking about this, I was really trying to figure out, I guess, how issues of cultural and diversity, they are core components of supervision. And I really am not sure that they can be disentangled from not only the general interactions, but really more specifically the critical feedback that happens, because supervisors and supervisees, they have learning histories, cultural backgrounds. We all have stimulus values that are going to impact every interaction. So I think the bottom line up front, the bluff, is that I think the approach is the same across contexts or topics of discussion. And ideally, we wouldn't have a completely different approach, and discussions about cultural issues would be infused through everything that we're doing. So it wouldn't be a standalone, different conversation that we're having. And there were a couple of things I was thinking about. I think in doing this, in terms of thinking about how do we create an environment where we can, that our trainees realize we want to get feedback and we value this. There were some things that came up for me as things to constantly keep in mind that I have to remind myself. And then there were things that I thought more about, things that I need to do. And as far as things to keep in mind, in the spirit of cultural humility, I think we have to continually strive to be culturally humble supervisors and to model that. And this means that we have to regulate that tendency that is natural for people to view their own beliefs and their worldviews as more superior or accurate to somebody else's, and especially in a situation with a power differential, potentially seeing those as more superior or accurate than supervisees. And then on the other side of that coin is being open to other people's beliefs, worldviews, and keeping awareness that we all have our own built-in biases and blind spots. And I think it's really important that we take a stance that just because we're the supervisor and we've been here longer, we've been doing it longer, it doesn't mean we know it all. And that's really important to let people know that you're still learning, and critical feedback is going to happen. And the other part of this as well is that I think, feedback is a gift. It is really difficult for trainees to give feedback. There's a lot that goes into that. I've mentioned the power differential, and not only how, cultural differences can exacerbate that differential, it can also be further highlighted by social identities. So for example, say, a white supervisor is working with a supervisee of a racial or ethnic minority background. So people have very real concerns about, whether their evaluations will suffer, whether they'll lose, future fellowship or job opportunities. So there's a lot on the line for them, and it's incredibly anxiety provoking for people to broach these topics. And so I think when they do give feedback, that's a gift, and to keep that in mind, because, I think that essentially means they're placing their trust in us and they want to improve the relationship. And then the last thing that I think is important to keep in mind is that, as much as we want to have these conversations, you can't force them. They are by invitation only. And so we do have to be respectful of whether trainees want to give feedback, how much they want to get into these discussions. And then in terms of more practically, things to do, Josh Hook, who is one of the authors of Cultural Humility, and one of his references is actually, I think, in the references of this slide deck, in a 2016 article, he talks about initiate, invite, and still approach. And so essentially, as a training director or supervisor, I think it's very important to take the initiative, to be proactive. And Joe was getting at this as well, of like setting the stage that these conversations are going to be happening. You know, as much as it can be tempting to avoid conversations around critical feedback or critical discussions, you really want to approach that rather than avoid it. And taking a stance of openness, sensitivity, humility, you want to identify yourself up front as like, hey, I'm somebody who is open to talking about these issues, and I'm somebody who wants feedback, and just letting them know that. Also normalizing the fact that, you know, at some point, it's not a matter of if, but when. There will come a time where you and the trainee as a supervisor, or the trainee and the training program, are going to have different reads on the conversation, or there's going to be some value conflicts there. And go ahead and prepare them and let them know, you know, we'll be talking about this. So I don't want you to feel like it's not normal. It's actually completely appropriate, and it's part of your professional development. The other thing that I think that some colleagues have taught me, and I think it's super important, is thinking about the supervisees, discussing with them specifically what their learning history is and their past experiences with respect to giving feedback. How has that been reinforced? How has that been punished? You know, what exposure they have so far. And, you know, making sure that you're understanding how that learning history comes into play. The other part about further normalizing this is there's actually a framework, and that's another article that's in this slide deck from Dunn et al. And they identify 3 steps. It's a really great article about how to handle critical feedback in supervision, or in the relationship between a training director and a supervisee. And I think to even further normalize it, you could say, hey, you know, there's this article, here's a framework. And when it comes time for us to have discussions, maybe this is a framework we could use, or what do you think about it? And I think that even gives people even more understanding that there's actually research on this very topic. And the last 2 things I'll say, and I feel like Joe now, like he said, I'm talking a lot, is that it's really important, again, going back to the point that you can't force these discussions, is to ask permission to explore difficult topics in supervision, and let trainees know that if they wish to stop the discussion, that you'll respect that. This can only happen in situations where people feel, you know, like they can trust you, and so you don't want to further, you don't want to harm someone by forcing them to have discussions. And then finally, when your supervisees do give you feedback, reinforce the heck out of it. It's like, all right, they finally, you know, gave you information about their experience, validate that that's their experience, and reassure them that bringing up these conversations is totally appropriate and commendable. So those are the things that I'm keeping in mind as far as what to keep in mind and what to do.
All right, thank you so much, Dr. Fulton. Kind of just to briefly summarize that, a lot of being open yourself to feedback, being aware of how you may respond and where your biases are, and letting the trainee set the pace after you've given the invitation. They may not take it that time, but they may take it at a subsequent time later when they feel more comfortable. All right, and then Tiffany, your question. How do you bring up something uncomfortable with a supervisor? What would be the thought process that would be involved in your approach to that situation? So kind of the flip side of the question for the supervisors.
Thank you, Rachel. So my name is Tiffany. My pronouns are she, her, hers. And I think one of the things that I'm going to do is actually flip the order of the question and kind of start with the thought process, you know, and I've seen a few people mention this in the chat, but there's an inherent power difference between a supervisor and a supervisee, particularly if you are earlier on in your journey to becoming a psychologist. So I think understanding that some supervisees, especially if we take into consideration potential negative past experiences or microaggressions that they have experienced, may be hesitant to be vulnerable in that space. You know, and I think on top of that, as a supervisee, something that I keep in mind are the numerous identities that are visible and are also invisible to my supervisor. So keeping in mind, what do they see about me and what do they not readily see that may factor into how I perceive a situation or how I interpret what is being done. So I think that's something that's really important, when you're bringing up something really uncomfortable with a supervisor, is kind of going, okay, as a supervisee, what do I have to potentially lose, or what do I feel at risk, because it's a position of vulnerability. Now, in terms of actually bringing something up, just like Dr. Fulton mentioned, looking at hook et al. And their initiate, invite, and still model. And while they take it from the perspective of the supervisor, I think we can use as supervisees as well and kind of sit there and go, okay, initiate. That engages my self-reflection. What am I perceiving in the situation? What are my thoughts? What do I need to consider when I bring this to my supervisor, both for myself and for them? The inviting. Part of being a supervisee is being open to the feedback of your supervisor who is licensed and who has a lot more experience than you do. So asking them for their viewpoint where it's similar to yours or where it differs. And then finally, this idea of instilling. As a supervisee, I can help shift the frame of the dynamic and say, this is the type of relationship I want to maintain with you with appropriate boundaries, but I really value in supervision being able to say, I want this type of supervision. These are the things that are important to me, and carrying that through in future supervision meetings, but also in how I discuss cases and assessments that I'm conducting.
Thank you. Yeah, I really resonate what you said about being so aware of the possible consequences versus benefits of bringing these issues up, and weighing that before we approach it. And then when you do approach it, if you decide that you need to, coming from a place of respect and respecting all of their knowledge, but also bringing your experiences to the forefront. And for both of your answers, really just about having that openness, and on the supervisor side, being aware that it takes so much courage for the trainee to come forward with this thing that could have big ramifications, and not pushing them and respecting whatever boundaries they're setting, but also on the supervisor side, your supervisee side, when you're bringing this up, respecting where they may be coming from too, because they do have more experience and they are licensed. Okay. And then our next slide.
All right. There was a question in the chat box about how to address situations in which trainee experiences microaggression by a supervisor, and guiding a discussion about that. And so I think some of the responses to these questions will address some of that, but if not, we'll circle back to it. So just wanted to make sure that person was aware, as well as a question about the racial microaggressions and supervision checklist, which is another really great area for us to touch on. So this next question is, how do you decide whether to bring up current events in supervision or with a client? In this context, when we talk about current events, we're talking about things like the breach of the Capitol that came up recently, the racial justice protests that have been going on last summer and afterward, and other socio-political events that impact diverse populations. And that's going to be for Dr. Fineman.
Yeah, and it's interesting the times that we live in and how this question may be different than other times, because right now it feels like and I shared this when I was thinking about this question before, that it feels like you're a late night comedian where like there's so much material now, you don't have to make an effort to find it or to make it be known. And so there's so much going on in our world that's so divisive that I guess the better question, at least this day and time, is how do you not bring up current events? How does it not come up in the room? Because it's going to come up, it's coming up whether you bring it up or not. There's a chance that wherever you're working, the patients that you're seeing or the trainees that you're supervising are having these discussions. But having said that, how how to bring it up within within supervision would be, again, if the stage has already been set beforehand that these are conversations that we're going to have, there should be some safety to be able to discuss this. But I mean, just being direct and transparent about how are you, on multiple levels, how are your patients dealing with it? How are you as a trainee dealing with this? How has this affected the way that you that you're viewing your patients or your care? And I don't really see it as a difficult segue into bringing it in. Now, what can be done to kind of bring it up in a way that that is effective and multi-layered is bringing it up within a lot of the constructs that we already know we have. How, like, one of the things that we've done a lot at our site is bringing up a lot of how these larger issues are affecting within like a socio-ecological model. How is this affecting at a large systemic layer? How is this affecting your patients or yourself at the community level or at the individual level? How do patients that already feel distrustful of, I work in the VA environment, so within the VA, how have these events either helped exacerbate that, or has that opened up conversations and possibilities to discuss this? And so I think within supervision, there's probably a safe enough place to be able to have or hopefully there's been a safe enough place developed where there's been already discussions about identity, about biases. There's been some transparency between the supervisor and the trainee. So that's a conversation that could be discussed on how it affects work. With clients, it can be this kind of like I was saying before, discussing it within a framework that you're working with. How is this enhancing the work? How is this taking away from the work? How is this context has been included since the beginning of therapy and treatment? And if it hasn't, why not? A lot of times the things that are really salient in our world are not being discussed in therapy and treatment. There may be there may be reasons for that. So we need to at least explore what's happening with that. And again, kind of like the way I answered the question earlier, transparency, appropriate transparency is a key. Like I talk with my trainees times that I mess things up, that I've had discussions. I'm like, oh, I don't know. I think I might have just used my power a little bit too much in that room. Or you know what? Why didn't we discuss this? We could have discussed this in so-and-so group and we didn't. What do you guys think about that? And making it collaborative, like really trying to take that power away that you're in this expert role and that you're going to say how this conversation goes. No, like making it as collaborative as possible with your trainees. And I think also respecting our trainees. A lot of our trainees are coming out of their programs with more recent knowledge than a lot of us as supervisors. They may be in certain areas more well-tuned or experts in understanding certain areas of diversity that we don't. That we, nobody in this knows everything and doesn't have blind spots. So honoring that and saying, what do you, creating a space where trainees can feel like they can bring their assets, their gifts, and how to further the conversation.
Thanks, Joe. I think it can be so important to initiate these conversations, like you're saying, and to be consistent as well. So, for example, if there have been a lot of Black Lives Matter protests that are going on, not just bringing that up for your African American trainees, but bringing it up with all of your trainees to get their perspective on how those factors are weighing in with them and the extent to which that's going to be coming up with their clients and how they'll address those things and everything along those lines.
And Jamylah, I'm sorry, just one more thing before
no more things.
The trainee perspective, because this was brought up in one of the articles that we reviewed too, is the also being mindful of our own biases and probably our own ideological biases. So creating a space where the conversation is open, and that a little bit like Dr. Fulton was referring to in the last response, creating a space where you can have differing points of view and that it can be discussed. And that doesn't mean you're not affected by it,
Right.
But you've created a safe space where you can have that discourse. So it's not just like-minded people talking to like-minded people and shutting down different points of view.
Yeah, absolutely, absolutely. One of the references talks about the liberal bias in psychology and as a whole, and creating space for diversity of viewpoints and perspectives without making the assumption that everyone is thinking about a particular issue the same way you are. So I think that's an excellent additional point to put up there. Dr. Rossitch, how do you decide whether to bring up current events in supervision or with a client?
Yeah, so there'll be a lot of parallels with what Dr. Fineman was saying, but I'll start with the how I decide to bring it up with clients first. And like as Dr. Fineman mentioned, like given that there's so much that's been going on, like in 2020 and now, and I've learned and practiced to kind of lean more on the side of bringing it up, because like given that all the different stressors that have been going on, we can't make any assumptions about how someone's reacting to a particular thing. And so one of the considerations is it may depend whether you're bringing up in like a group or like in an individual context. So one of the ways I've approached it is with my individual clients mentioning sort of like, hey, like I know, X has been going on, and recognizing that people have different reactions to these different stressors, and wanting to bring it up in our session together, because sometimes it might be helpful to bring up emotions that they might be feeling, and also allowing that space to make it that it's okay to not talk about it. And having just prefacing the beginning of our sessions with that, I find has been helpful, because sometimes clients come in and don't realize like what is like quote unquote appropriate or relevant to bring up in therapy and what isn't. And so by setting the stage and saying like, hey, this is important, this matters, we can set some time to talk about it if it would be helpful for you. And there have been times when clients don't take me up on that, like the first time, but later on, they're more comfortable bringing it up, like something else that's come up in their lives. So I think it's really important to set the stage and really make it known that it's okay to bring up these issues. And sometimes like the clients don't ever want to talk about that again, and that's also okay, but making it known that that's something that you're open to exploring with them. In supervision, while I take a similar approach, I've also noticed in myself, like I've actually found it a little more challenging bringing these issues up in supervision. And I think a lot of it does have to do with the power differential. And so one of the considerations I've taken into account is like, have we had these discussions before? Has the supervisor made it known or brought these up on their own? And I will admit it's often a lot easier to bring these topics up when the supervisor has already mentioned like, hey, this is okay to talk about. But when that hasn't been the case, one of the ways I think about it is like how I decide is I think about like how comfortable I am with that particular supervisor. Fortunately, I've been felt very lucky this year, and that I've had really great supervisors, and I've felt open talking about these issues. And especially with like just the magnitude of the different things, bringing it up, both in terms of like getting consultation or validation about how these events might be affecting me as a person, and also getting feedback about like the lens that I'm seeing things through. Like, are there particular biases that I have that I'm not aware of? And having that conversation, recognizing that like that level of vulnerability, like you may not feel comfortable with every supervisor, but finding those supervisors where you can have those conversations, I have found super helpful. And I feel like those have led to discussions about like taking more time for self-care, or recognizing how these stressors have affected you personally or your loved ones, and taking that time, that space that maybe as a trainee, because of these expectations that you might have about yourself and your performance and being evaluated, having that discussion with the supervisor has been very helpful for me. And I think also kind of going back to the discussion about when a supervisor brings it up. Sometimes there have been times where I don't want to, like, I'm trying to distract, or I'm trying to like kind of get through the day. And I think having the supervisor bring that up, I think from the trainee perspective is still very valuable, because even if I don't want to bring it up then, like it opens the door for those future conversations. So I think I've learned more and more sort of like my style, and also listening to kind of my emotions or what I'm feeling, and having those conversations and bringing it out to the open, both my supervisors as well as with my clients.
Yeah, absolutely. And I think keeping the door open for ongoing feedback is something that sometimes can be a struggle for supervisors. And so, you know, like you're saying, the more, if the supervisors open the door, then yes, totally. It makes it really easy to bring it up. But when the supervisor hasn't, sometimes it takes some finesse. There are some questions in the Q&A about different checklists and different measures that can be helpful along these lines. Feedback informed supervision by Scott Miller can be a really useful tool. It's parallel to feedback informed treatment, but basically the process is that for every single supervision session you have, you and the supervisee fill out like a little 3-question rating form about how the supervision went, how the person is rating the supervisor relationship, whether or not their goals were met, and 1 or 2 other things. And so it makes me think about how clinically sometimes it's easier for people to write things down, even if you're asking them about it. So it makes me think of clinical situations in which you ask a patient how they've been doing, and they say, oh, more or less fine. But then you look at their BDI or PHQ-9, and they're endorsing some suicidal thoughts or something that they didn't bring up, even when you kind of asked about their mood. So sometimes for whatever reason, it can be easier for people to write things down, but them writing it down, knowing that they're going to talk to you about it, opens the door to having some of those conversations. So that can be a great way to keep the door open for ongoing feedback versus having to feel like you're needing to be super intentional every single time.
All right. And so I think this is one of the big questions of how do you know if this went well or if it's going well? And so starting with Dr. Fulton, from your perspective, how do you gauge whether discussion of a challenging topic has been effective?
And for this one, Rachel, I'm just going to hop in for just a second. There was a question in the Q&A about the extent to which, how do you handle these situations when a supervisor feels like they're maybe not open to feedback and things like that. So just when we get around to the trainee response, we can work in a little something about that too.
Thanks, Rachel. It's interesting because in the training director role, I've stepped away from doing individual supervision. And so it's been a couple of years now since I've had my own supervisees. And so this was, as we were getting ready for this talk and preparing, it was really the first time in a while that I've been able to like have consolidated time to reflect on supervision experiences and with trainees, again, since I haven't been doing that particular part in a while. And, you know, to be honest, when I look at the title of the slide, I think that went well. I mean, in thinking back on the memories of this, I had times, you know, that made me smile or feel proud. And I definitely had times where I was cringing. And I just want to acknowledge that it's a growing process for supervisors as much as it is for supervisees. And I think that I've learned as much, if not more, from my supervisees as they've learned from me. So I would just say that if anybody's looking at this slide and thinking that you could relate to one that said like, okay, I really botched that up, you probably would not be alone. So solidarity. And I guess I feel torn about this particular question because, I mean, I feel like you can never know for sure how things went. And as much as we can try to assess things or ask directly, you know, to some degree, we can only just take our cues from what occurs. But I think in general, if supervisors, and as you've heard from trainees so far and people in the chat who are like desperately wanting their supervisors to have these conversations, if supervisors invite diversity-centered conversations in a way that's culturally humble with a genuine stance of being open, curious, and respectful. I truly think that supervisees, they experience they feel validated, they feel supported, and they feel less fearful of discussing issues in both supervision and therapy. So I think that's one sign that it went well, that you did that to begin with, right? And also, I guess the main things that I would think to look at from a behavioral perspective is like indicators. Did they reinforce what I did? Watching their body language when we're talking. Did they express appreciation for the conversation? Did they talk more, go silent? Did they initiate similar conversations? You know, have they been avoiding me since that conversation? That's probably not a good sign. And then, you know, on the other hand, obviously, if they're saying thank you, if they're wanting to talk about this more, you know, I think that indicates that they are feeling like the conversation went well. I think it can also be helpful to have a colleague to consult with and sort of share what you saw happening in that interaction with your supervisee. And if you can find somebody with enough nuance difference in how you see things, and even better, if you could find somebody who aligns more with maybe the supervisee's perspective, then that can help you learn more about your blind spots or areas for growth. So I think, you know, we don't want to put all of the emotional labor on our trainees to continuously give us feedback about how we did or like how well that went. It's good to share those scenarios with colleagues who can help you think your way through it, think about other ways to approach the situation. And I would say, you know, as tempting as it can be, really to avoid the tendency to want to seek reassurance from somebody and ask them, hey, did that go okay? Like, are you okay? How are you feeling about that? If the whole point of it is to make you feel better, and giving them room to process how things go. And then, I mean, you know, from an empirical standpoint, there's definitely measures where you can measure your alliance in supervision over time. And I suspect that a trainee who feels shut down in a conversation is not going to be very willing to share on a measure that they're not feeling like the alliance is very well going very well. So yeah, I mean, I think, again, it's hard to know for sure, but these are just some of the things that come to mind for me. And so I'm interested to hear, Tiffany, what you think about this.
Thank you, Dr. Fulton. I think the thing I really like what you said about almost finding your own supervision in issues, that if you've had this conversation, seeking out feedback from not just the student, but also your colleagues, and be like, this is what I did, what's your perspective on it? And yeah, I guess, Tiffany, what is your side of things? So from your perspective, what supports you feeling that a discussion of a challenging topic has been helpful?
So I kind of love the fact that I get to deal with the feeling aspect, you know, looking at this from the supervisee perspective, because I think we have all been there as a supervisee where we have felt really vulnerable and we haven't felt seen. And we walk out of that meeting and we kind of go, oh, that was awful, right? But thinking about how we can assess that and kind of reflect is walking out and very simply, do I feel seen and heard in that dynamic now? Do I feel like I have walked away from that meeting with my supervisor having a better understanding of who I am, the perspectives that I bring to our meetings, to potential conflicts? And also kind of moving forward, you know, I think one of the things that we talked about as a panel earlier in one of our meetings was this idea of realizing that sometimes it's going to take time for us to feel like something was helpful and beneficial, because we're still in the moment feeling our feelings. And sometimes it's going to take a week or 2 weeks or maybe a couple of weeks. It might also require that we come together and meet each other once again and kind of have multiple conversations around this.
Yeah, thank you. I think that's also really helpful for supervisors to hear, is that the feedback that you're looking for may not be immediate. It may take a few weeks to get feedback from Supervisor on if what went well and what went less well about that conversation. All right, thank you.
All right, this last question, and we are paying attention to the time, so it's 2:51, so we'll try to go pretty quickly with this one. But how do you help trainees to address systemic issues within an organization or within a cohort? That's going to be a Dr. Fineman question.
Great, and I'm going to be very brief, just for the purpose to give some time for question and answers, because I know we're running up against the hour. But what I would say is in regards to dealing with systemic issues is talking about your organization with almost the same level of transparency. There's no organization that's perfect. And to get away from the zero-sum game of like, you're either doing things right or wrong. There's chances that there's likely in every organization things that they're doing well and things that they're not doing well. And so having those conversations openly with your trainees and already knowing what you've been in the system as a supervisor for years, so you know the pluses and the minuses. I know in our training program, we have a lot of different rotations. We have a lot of different possibilities for trainees, but because we have so much to offer, it can become hierarchical at times where it's not as collaborative because it's like, oh, I got to get this done on this rotation. I got to get this done on that. So I'm pretty transparent and say, oh, how are you dealing with this environment that, you know, has you pulled around in many places, oftentimes may limit your voice. How are you dealing with that? So already kind of discussing some things that you know about the system without waiting to find out if the trainee catches on to it and if they're going to talk about it. And in fact, I think a few years ago, the VA TPC did a study on what trainees are looking at in regards to diversity factors. And one of the things that came back is they're already seeing what the system is and if there's any microaggressions going on to them when they're coming to interview. So they're already keeping track of things as the year is going by. So let's make this part of the conversation. Let's discuss what things are going well and what isn't going so well. And within the cohort, pretty much the same, talking about the experience of coming into an internship or residency program or whatever level, and you're interacting with other people that you don't have relationships with before. How's that going? How's it going interacting with your peers? Luckily in our program, we also have a person that's for diversity professional development that's non-evaluative. So that creates a different space that takes away that evaluation portion. But having that as an ongoing conversation through the year. I think with the cohort, it's a little bit more difficult, at least in my end, because I don't work with everybody in the cohort, but there have been times where, because there's been so much safety in our clinical work and our supervisory work, trainees have brought up issues within the cohort.
Yeah, I think similar to what you're talking about and what we've been discussing, the more you're able to initiate these things, it opens the door for trainees who might be really troubled by a particular issue, but not know whether or not it's appropriate or okay to bring it up with a particular supervisor since they're not the head of a department or who knows, you know, where the larger issue might be. It makes me think of the executive order on racial and gender stereotyping that existed from October to February or so, that caused a lot of angst for many of our VA trainees, federal trainees, and things like that, and initiating those discussions because some of them were afraid to bring it up and weren't sure the extent to which that would or wouldn't impact their training and things like that. So last but not least, what aspects of a program's culture have you observed that create an environment that encourage trainees to support each other?
Yeah, so I'll keep this short in the interest of time, but I think the things that stuck out to me is like aspects that really in an environment that make it easier for trainees to support each other and also for us to be comfortable as trainees is, I think, being receptive to feedback and asking for it continually. And also like when the program receives feedback, taking a non-defensive stance and recognizing and saying like, these are reasons why like we can't make these changes, or like, you know, making the effort to make those changes. So I think that's been really important in the programs that I've been involved in, is feeling comfortable being able to say like, hey, this is working, this isn't really working, and highlighting that, you know, given that there is a power differential, trainees are going to be more uncomfortable giving feedback that is critical. And I think the transparency of it and being able to handle it and say like, yes, we can change this, or here's why we cannot. And I think also in terms of creating an environment with trainees being able to support each other, is especially now with a lot of sites being 100% telework, it's really hard for trainees to really get to know each other and kind of be open and vulnerable with each other. And so creating spaces where trainees could still get to know each other and have that cohort environment. And one of the things I really like about our program is having what's called this like intern retreat, where it serves as both kind of having interns get together, or postdocs get together, both in like a social outing, as well as coming up, discussing aspects of the program they like and aspects of the program they want to see improvements on, and writing a document that goes to like the training director about these are the things we enjoy. And I think it was a great experience for us to really come together, discuss what are aspects that we're finding really helpful, or things that we're struggling with, and kind of power in numbers and being able to provide that feedback. So that's just one example of one of the ways to kind of create that environment where trainees can be there for one another, and also be open to discussing these areas of things to change.
Yeah. Absolutely. I'm going to turn it over to Rachel. Unfortunately, we won't have time for many more questions. If you want to type questions, panelists and myself have been answering some of the questions as they come up. So feel free to type in questions, and we'll be happy to try to address them as we move along.
All right, yeah, so speed going through this. Next steps. I put it this way for a reason, and it's because while the trainee, I think we have roles as and responsibilities as people and as future clinicians to really work on our ability to discuss these topics and to bring them up and feel comfortable with them. We also do have some of the less amount of power in most of these situations, and people supervisor program in general have a lot more power. And so some of the onus will have to rest on that just to change some of the systemic issues. But then going to the next slide. Did want to just include some general resources. The VA section, both the student page and in general, has a lot of different resources for just learning about and discussing about different areas of culture and different clinical situations, which it comes up. I also didn't include a cultural competency training in here. And I made a quick bullet point about movies, books, podcasts. One of the things that are mentioned in these articles we've been talking about is there has to be kind of an immersion aspect of, if you know where your blind spot is and you're aware of it, taking active steps to learn more about it and to learn about these people who have different life experiences, different perspectives, different cultures than you. And a place to start could be with just some specific books or podcasts about these topics, or just engaging in media that not necessarily center you or people who are like you. As well as moving on to the supervision part of it. These frameworks have been kind of talked about in depth, so I'm not going to go over them again, but I think there was a question earlier about how to engage colleagues who are reluctant to, and I think these same frameworks can work for that, where if you're modeling being culturally aware and having discussions with your supervisees, people around you are going to pick up on that, and it's going to model that behavior. So taking these frameworks and applying them in more than just one situation. They're not just for supervision. And as Tiffany said, they can go back from supervisee to supervisor. And then lastly, for those who have the ability to advocate at the program level and who have a lot more power there, protecting time in meetings, in supervision, in trainings, just putting it into the structure and advocating for it to be a part of the structure.
All right, and this last slide is just an example of that detect, articulate, respond model that's in that Dunn article, and all the different ways that they outline and some concrete strategies for detecting value conflict between you and the trainee, and working through how to process those things. And these are the references that were used today. And if you click on these links, it'll take you right to the articles for these two. And that is all we have. I believe these slides will be made available. Dr. Iromasa, do you know?
Hi, everyone. Yes, thanks to those who stayed on. I did mention at the very beginning of the webinar that this recording will be on the VA section webinar page. If you scroll up in the chat, I put it in there somewhere. I will post it again before we close out this meeting. And so this webinar, as well as all of our other VA section webinars, are available free of charge for anybody who wants to see them. And these slides will be posted there as well. So you all have been so fabulous. Just watching the chat go by and looking at all the questions that folks have, I'm already thinking of part 2. So Rachel and Jamylah, the rest of the panelists, I think there's so much material here. There's so much interest. I think that this has been very supportive for both supervisors and trainees. It's such an important conversation, I think, for us to have and to be comfortable having. So thank you to all of you for sharing your personal experiences with this very large audience today. But on that note, I know people have to drop off, including myself. So thank you all. And I think, like I said, you know, we're going to keep the questions from the chat and consider part 2. And if you have suggestions or ideas about that, please certainly feel free to email us at the Division 18 Outlook email on the flyer and registration materials. And on that note, I'm going to call it a day. Thanks, everybody. Have a great one. We'll see you at the next webinar.
Thanks. See you guys later.
Bye.
Thank you.
Mhm.